everyone. I'm Dr. Rajesh Kataria, practicing dermatologist from Indore. Here I'm to discuss a topic which is urticaria. So we'll be discussing what is urticaria, how it happens, and how we can prevent it and how we can treat it. So urticaria is basically an skin allergy. There can be lot of triggering factors to induce an urticaria. Sometimes these triggering factors are identifiable, but most of the time they are not identified. Usually, people think urticaria is a disease most of the time foodborne, but it is not the truth. It is rarely because of intake of some certain kinds of food, but there are other triggering factors also. Sometimes it can be induced by simple things like cold, pressure, etc. When the cause of urticaria cannot be identified in long-term basis, say for the urticaria is long-lasting, then we label it as a case of chronic spontaneous or chronic idiopathic urticaria. So, urticaria is basically how it looks. That is more important. Urticaria looks like a rash. In common language, this rash is called hives, which is characterized by, you know, innumerable lesions, innumerable rash over the body with irregular shapes and irregular sizes. So, urticaria can occur at any time during the day. Most of the time, these cases are most the incidence of such cases actually increases in changing weather. So, we can treat urticaria by avoiding triggering factor if we can identify it, but it is actually very difficult to identify. The other common things we need to follow, like if we found the pressure is the cause or the certain temperature change is the cause, or sometimes even water can be the reason, so we can avoid them accordingly. But if the triggering factor is not available or we cannot identify the triggering factor to appear or appearance of this rash, we can simply focus on anti-allergic drugs, which are very safe alternatives to steroids, which are usually not used, but sometimes they can be used. So there are a lot of anti-allergic drugs available. We should continue it for longer periods. As far as a qualified dermatologist will suggest, you should not stop it by your own. And for further information, you can contact your dermatologist, because the dermatologists are the safest person to treat any kind of skin disease.
For more such videos, visit or log into dermavidya.com.